I'm talking to Jessie Hoskins, who is from Kaikoui, and she is a practice manager for several practices up there, aren't you?
On my good days.
When you're behaving, yeah.
Right.
Yeah. So just tell us a little bit about the work that you're doing and how you got into it. And
Okay. I started working in Broadway Health as a maternity cover because
cool.
we went to rural Northland and had a look at this wonderful practice, and that was 9 years ago. And so I was just in and out of there, and then I went back and applied for the business manager role when it was a single practice, and in 2012 we expanded to Waipapa, which is just out of Kirikiri and has no VLCA funded medical centre in Kirikiri.
Oh, wow.
So we opened Waipapa to address a need that was identified with the rural workforce moving to Waipapa where the development is.
Yeah.
We had some feedback that they wanted to have a more affordable healthcare in that area.
Yeah.
And then in 2015 we started negotiating with Lance O'Sullivan to buy Te Kohanga Whakaora, which I had worked with him to set up.
Yeah.
And February last year we took it over. So we have 3 practices.
Yeah.
And they service the larger Northland area. We have a single medtech system, so our transient community from Kaikoui can be seen at any 3 of our locations, which has really reduced, I think, a lot of the pressure on when you live in such a high Māori environment. They will go and stay with Nana for 3 weeks and Auntie for 2 and then the sister of a sister and for another 2, and that's all over the area in Northland. So it's been nice, it's been an experience, and
that's a great solution for that travelling population.
And they are so sick if they don't have relevant up-to-date information at the fingertips of the next doctor they see. We will see them in a discharge summary because they've just gone to hospital, which you would understand.
No, totally. And so there's quite a lot of pressure on GPs in rural areas, and I imagine in your area just as much as anywhere else, or probably more so.
Yeah. Well, I guess the after-hours demand, the issues around workforce, the lack of workforce retention, and the fact that all of our GPs, so 4 GPs own our company, and they all work in the practice, and we have a total of 9 GPs working for us, and only 1 is New Zealand trained.
Wow.
So that is something when you think about an FTE equivalent being that type of percentage trained in New Zealand. It's been really hard, and identifying the cultural, so nephritis, let's talk about that, and let's talk about the number of GPs who work for me who have never seen it before they came to work in Kaikoui. You know, so we've really found some huge challenges in finding a workforce who, they are all skilled and they are all amazing and they all genuinely care. They just don't have the experience with a whole lot of illnesses like strep throat, rheumatic fever, heart disease, all of that. So we have them in an acute clinic setting in all of our clinics. They run an acute clinic every day. And then they go to do an after-hours session and then a Saturday session and then just constantly working, which Taka will talk to you about. And everyone has young families, and it's just a really demanding environment to work in. And when your closest hospital is Whangarei, okay, we have Kawakawa and Kaitaia, but they're not full service, is over 45 minutes away, and people will challenge you if you want to send their child by ambulance because they'll get a bill. And they can't drive and they can't think. The social pressure on all of our patients is just amazing. So then we have these clinicians trying to give quality care without any resources apart from what they're willing to take out of their back pocket. It's like we're pushed to make solutions, to come up with our own solutions to national problems. And I think that's the biggest issue for me. We have to sit around the table on a Sunday at someone's house and have this big brainstorm to sort out things that the government tells me they're fixing. You know, to come up with rational solutions to irrational problems. Like it's just...
So there is some stuff that you're working towards, and you have changed your call centre stuff. You were saying,
we are introducing our own call centre. We've got almost Star Trek-like, you know, Starship Enterprise room at our clinic in Kaikui now, where there's 4 workstations, and each workstation has a medtech screen and a call centre screen, and we are wanting to make sure that the right person is seeing the right patient at the right time. So we're triaging from start to finish at every call that comes into our clinic.
Oh, that's good.
To try and reduce the demand and streamline processes and to protect the resources that are so limited, our GPs and nurse practitioners, and just trying to model our environment to fit the demands.
And you've got quite a large population of patients that you deal with too, haven't you?
Yes, just under 16,000.
Wow,
so, it's a challenge.
Busy times for your GPs, and hopefully with your new ideas with management and stuff, that things will transform a bit for them.
Incorporating admin time into their day, protecting them from inappropriate booking.
No, that's great.
Creating walk-in clinics and acute clinics. It's all new, but it'll be great.
Very good. Well, it's been lovely chatting to you.
Thank you.
It's nice to see some, just innovative ideas coming out, and I know it's hard when there are no easy answers to problems, but it's good to see that creativity still exists, and you're doing a great job with it. Thank you.
Thank you.
Great.
Thanks for having me.